Well, good morning, everyone. How are you? Hope you're having a great start to your day. We're going to do the roll call. Wait for a few folks to come on. You get your notices. Good morning, Georgie. Halifax, right, Georgie? Nova Scotia. And Barbara, good morning. And Mike from Norland. Jen. And John, Elgin, Illinois. Diane, good morning. Mary. And Nick from our staff. Militia. Hi, Militia. And I had it right about Georgie in Halifax. Wendy. Martha. Kim, good morning. Fran from Orangeville, good morning. Donna. And Sharon. Let the good times roll. Yes, for sure. Susan. Elaine. St. John's, Newfoundland. Beautiful. Regina. Suzanne. Joss. Baxter, Ontario. Jean. And Jeanette. Linda. Good morning. Lorraine. How are you guys? Tamara. Nice to have you on, Tamara. Christy. And Odilia. And Rosalinda. Niagara Falls. Margaret. Suzanne. Learning time, she says. Yep. Wendy. Good morning from London. Mara. Sue. Good morning. And Susan. Florida. Sandy, Washington State. Annalisa. And Christina. Tirana. Catherine. Mount Pearl, Newfoundland. Good morning. Helen. Couple more and we'll get going. Diane. How are you? From Nouveau Brunswick. Kevin. Oshawa. Linda. Jan. And Margaret. Lakelet. Okay. Bruno. Quebec, right, Bruno? Sue. Manitoulin Island. Deb from Motown, Detroit. Diane, good morning. Colette, good morning. Dorothy. Guys, nice to have you on with us this morning. Let's get going. I got a couple of things. I don't know if I'll hit two or one this morning. One of them is there's 3 or 4 interesting studies that came out. And I'm going to tie these two together about probiotics, okay? I'm going to tie these two stories. One, antibiotic resistant E. coli from chicken, okay? Just a study that was done. Antibiotic resistant. So you know what that is, right? It's resistance. We often talk about insulin resistance, but here's a real big problem in our society today, as far as health goes, are resistant bacteria. They're resistant to antibiotics. One of the worst ones is C. difficile. When you go to a hospital, because that's where C. difficile is found. It's found in the hospitals. And listen, of course, you need antibiotics. You're in a hospital. You had an operation. You had surgery. Wow. You need an antibiotic. Come on. Problem is, bugs have intelligence. Okay? Bugs have intelligence. I've been telling you that for a long time. And they develop resistance. It's almost like a coating on themselves, and they become resistant to antibiotics. So let me finish the story. We'll talk about this for a minute or two. antibiotic-resistant chicken, E. coli. E. coli, ladies, have you ever had a bladder infection? 99% of the time, it's an E. coli bacteria. If it gets in your gut, it can create havoc. If it gets in your bladder, it can create havoc and recurring urinary tract infections. Women know all about that kind of stuff. Men, not so much. I mean, they can get an E. coli. Usually when a man gets an E. coli, it will be in his gut, where you picked up a bug and, can be salmonella or whatever, and you get like a food poisoning. But this is a chicken, an antibiotic E. coli, antibiotic resistant E. coli found in chicken, and it's transferred to the human gut. This is the study, within a few hours. Okay. And, I don't have to tell you about cooking or anything like that. Make sure, you don't eat chicken that's partially cooked, right? And, we all know that kind of thing. But today, you have bacteria that is much more resilient. We live in a different world. One of them is the overuse of antibiotics. And so when you pick up a chicken in the grocery store, you know what? Make sure you cook it properly, but you can't always kill all the bacteria. That's the point of this story. It can be transferred. This resistant bug, an E. coli, can be transferred within a few hours and can start to create havoc inside the body. So what do you do about that? It's another reason, guys. It's another reason that I talk about this all the time. Broad spectrum probiotics. When you have a microbiome that's in good shape, when you have a microbiome that is on your side, this is why we went from the Martin Clinic talking about taking probiotic. Now, this is, 10 years ago, more than that. We went based on our clinical experience. I remember the day that Tony Jr. and I talked about it. We were at his place and we were discussing the clinic, and we were talking about probiotics, and we came to the conclusion at the same time, you know what, we need to start recommending probiotics to everyone and on a daily basis. We went from at least 2 times a year, take some probiotics. I used to tell my patients years ago, spring and fall. do a spring cleaning and a fall preparation with probiotics. Get ready for the winter with probiotics because it was so good for your immune system. But because of many reasons, I remember, even like I said, it's got to be over 10 years ago, that conversation that Tony Jr. and I had. We talked about doing it on a daily basis because there was study after study coming in from your head to your toes about the importance of probiotics and, of course, of the world in which you and I live. Full of chemicals, full of heavy metals, full of bacteria, resistant to antibiotics. We don't live in a perfect world. We don't live in the Garden of Eden, do we? No, we live in a very imperfect world. As beautiful as the world is, there's a lot of things that can attack you, and things you can't see. You couldn't see an E. coli if your life depended on it. You can't see that. You can't see it. And you need protection from chemicals and from bacteria and from viruses. And the gut is an important thing, isn't it? Like, the health of our gut affects our immune system. Sure, because even there, you need a healthy gut to absorb your vitamin D properly. Yeah, I realize vitamin D, the Viderma, the sun, yeah, can't beat it. You really can't. But there needs to be a healthy gut. And you can't have it. And I'm not even talking, guys, I'm not talking about digestive symptoms. You can have leaky gut without any symptoms of digestive problems. Oh, doc, my gut's perfect. I can eat anything. Doesn't bother me or whatever. No, because you have more. You have, actually, I read a study on the weekend. I don't know if I agree with this researcher or not, but you know when I tell you, when you get on a scale, to take 3 pounds off, okay? Tony always said 4, I said 3. Okay? Take 3 pounds off because you got 3 pounds of bacteria. So that don't count on the scale. So you've already lost 3 pounds. Now tell me how good that makes you feel, right? Tony Jr. used to give his patients a -4 right out of the gate. I gave them a -3. I think he was more right than me, and I'll tell you why. Because the newest research coming out is you got 6 pounds of bacteria in your body. -6 on this scale. I know women would love, men too, gotta like that. What do you mean? Yeah, 6 pounds. Take it right off the top. They're bacteria. But understand this. When it comes to bacteria in your gut, you can't see them. You can't see them. They're invisible to the naked eye. Okay? But that doesn't mean they don't exist. Right? Of course they exist. And it's interesting that medicine is taking a real look for really the first time about bacteria. It's becoming a real important part of research. Research is fascinated by the microbiome. Fascinated by it. Isn't it interesting that Hippocrates, 2,000 years ago, talked about the gut? All diseases originate in the gut. Hippocrates, the father of medicine. And the more we study bacteria, the more we agree with Hippocrates. E. coli. You can't see it. You can't see E. coli. It can transfer within a few hours and set up shop in your gut. And can bring on a raging infection. Now, what stops that? Sure, your T cells and all this and that, absolutely. That's why you need vitamin D. It charges up your T cells, your Navy SEALs. They see E. coli. They know that that's a bad actor and don't belong, and we're going to get rid of it. But in the presence, and this was what the study was talking about, in the presence of a healthy microbiome, E. coli cannot flourish. In the presence of a healthy microbiome. How do you have a healthy microbiome? You got to have more good guys than bad guys. And this has been, of course, the curse of the antibiotic. You see, foods, even when you're eating food, if they've been treated, if the animals and the feed or whatever has been treated with antibiotics, and by the way, I say this all the time, and it's worth repeating. You're never going to get a perfect world. Like I said, you don't live in the Garden of Eden. That's the headline. You don't. And, Dr. Martin, I eat nothing but organic. Well, good for you. I mean that. I'm happy you do. But if you think you're going to get away from antibiotic resistant bacteria, you'd have to leave the planet. There's no getting around it. That's the kind of world that you and I live in. And if we can accept that, okay, I accept that. Now you see, like for me, I want to prepare you for the world in which we live. I want to prepare you as an individual. Because, it's the way it is. I mean, and I'm not optimistic, okay? I'm really not, that things are going to change much in the world. Are we going to stop giving antibiotics for no reason? Like I brought this to you. You can go back to a previous podcast. I talked about look at it. Here was the headline that I used for that podcast. Doctors are not getting the memo. Now I can't even remember how long ago now. Not that long ago. Doctors are not getting the memo. What is that? What was the story about? Well, it said that 70% or whatever it was, percent, I can't remember exactly what it was, doctors are not getting the memo. They're giving out antibiotics for a viral infection. You don't give antibiotics for a virus. You don't give antibiotics for a cold. You shouldn't give antibiotics for a virus that's giving you an earache unless you see pus. I mean literal pus coming out your ear. You have look, are ear infections any fun? Absolutely not. They're not fun. But an antibiotic ain't going to tell, oh yeah, but I took an antibiotic, it got better. It was going to get better anyway. Now, I'm not saying you shouldn't treat it and kill the pain and, I'm not saying that. What I am saying is an antibiotic, we give out antibiotics like candies. I've talked to dentists over the years. Why are you giving an antibiotic to patients that don't have an infection because you want to prevent an infection because they're coming in to get teeth work done on their teeth? Use a probiotic, not an antibiotic. I used to tell my dentist friends that. What are you doing? You're part of the problem of making resistant bacteria. You're part of the problem. And we're having a problem with too much antibiotic. Okay. Now back to the story. Okay, back to the story. It's important, my friend, it's important to take probiotics. It's essential, in my opinion, in the world in which we live. And when you take a broad spectrum probiotic, it helps. If you have a yeast, a fungus, which is a major problem, that's the invasion of the Third Army. It's the invasion of the Third Army, my friend. Yeast. From dandruff on your scalp to fungus in your toe. That's what you see on the outside. But I'm telling you, you're full of yeast on the inside. Most recurring sinus infections are fungal. Well, an antibiotic ain't going to fix that. You need to kill the yeast. You need to kill the fungus. How did it get in there? Because you had an imbalance between good and bad. You had too many bad, not enough good. And that can happen when you feed the bad guys. That's why we come back to nutrition. We come back to nutrition, food. When you eat sugar, when you eat crappy carbohydrates, you're feeding the bad guys. And now you create what we call I hate these big words, a dysbiosis. I hate that word. I use it only to tell you what medicine calls it. And you know what? Can I be honest? 99% of doctors still don't get the memo, not on antibiotics only, about the good bacteria. If a probiotic hit them, they wouldn't know what hit them. It bothers me. There's so much research on probiotics. There's so much research on different bacteria doing different things and how good they are for you and what they do, not only to help your gut and patch up leaky gut, which is one of the 3 causes of all disease. Leaky gut. Probiotics help fix it. And you feed your friendly bacteria. Let me just say this, because this is controversial, but I know I'm right. Okay? This is controversial and I know I'm right. How do you feed your good bacteria? Well, first of all, don't feed the bad guys. Sugar and crappy carbs. But you need fiber to feed your good bacteria. I'm going to tell you what feeds your good bacteria, my friend. Eggs, meat, and cheese. Good bacteria love that food. They thrive on it. I know all about prebiotics. The best prebiotic is a steak. Even though I know what a prebiotic is. I've been talking about this for 40 years or more. Now, the second part of the second study that I want to talk to you about comes from, this is really important. It's a study on L. rhamnosus. Okay? Now, what's that? Again, Latin. Okay? I was told in high school I needed Latin. I hated Latin. Okay? You still got to memorize, whether you know Latin or not. If you're going to go to medical school or whatever, you're going to be a nurse or whatever, you got to memorize anatomy, okay? Like, whether you know Latin or not, what does that do for you? Not much. Okay? L. rhamnosus is a bacterial strain that they studied, okay? And let me tell you what it says. L. rhamnosus contains, think of a bacteria. It contains a neurotransmitter called GABA. The gut-brain connection, my friend. The gut-brain connection. It is so fascinating. Now, here's what we know. Serotonin. Okay? Dopamine. Oxytocin. Okay? These are hormones. Okay? These are feel-good hormones. Serotonin, dopamine, oxytocin. Okay? Not with a CIN at the end. Okay? And you have more. Okay? 95% of your serotonin. How do we know the name serotonin? Well, because a lot of people, if they're on antidepressants or anti-anxiety medications, they give them SSRIs. Serotonin receptors, medication. Okay? Now, 95% of your serotonin is found in your gut, not your brain. Your feel-good hormone is primarily found in your gut, not your brain. But they communicate. And this is what is one of the most fascinating things to me, is the intelligence of bacteria. They talk to each other. Hey, serotonin in the gut, how you doing? Are you feeling pretty good? You see, this is key, guys. This is key. Because another study, okay, one is serotonin. We talked a lot about that. The other one is GABA, a neurotransmitter. And you better have the right bacteria. You better have good bacteria. See, L. rhamnosus, okay? I'm very familiar with L. rhamnosus and L. reuteri. I love those two bacterial strains. I've studied them for a long time. Why do I like those two things? Look, I like broad spectrum. I like a lot of them, including, because most people, when you talk to them about probiotic, they think of acidophilus. Okay? Eat your yogurt. Yeah. It's got acidophilus. Yeah, if you made it. Don't have much acidophilus if you buy it in the grocery store. Because it had to be pasteurized. At, 1200 degrees? That'll kill your bacteria. Anywho. L. reuteri, L. rhamnosus. I've always used that because they go after yeast, fungus. I'm really, really big on that. Okay? The third invasive army. I like L-rhamnosus for that. I like L-reuteri for that. I like them in combination. I found over the years that they were very effective when they're put together. And the more they study, like L-rhamnosus contains the neurotransmitter GABA. Wow. You talk about important for mental health. And remember, I was always a history guy. Give me your history. Tell me your story. I was very interested in your story. Tell me about your childhood. Were you on antibiotics for years? Yeah, I took a lot of antibiotics. You know how many people I saw in my office with severe digestive issues, and they had taken antibiotics as kids for recurring ear infections or even for acne, tetracycline. The key. And even for depression later on. You see, medicine never they never connect stuff. They don't connect it. You're depressed. Here's SSRIs. Here's a Band-Aid. At best. It's a Band-Aid. But you can rarely ever get anyone to take a history and say, well, okay, when you were a kid, tell me about that. How were your hormones? Oh, they were messed up. Okay. Were you on a lot of antibiotics? Yeah, I was, come to think of it. Yeah, well, that could have had a major effect on depression. It doesn't happen in a day. It could have messed you up. Started with that. And take years for it to develop into a full-blown depression. Mental health issues. The gut-brain connection. It's so important. And these two studies, one of them antibiotic resistant E. coli is coming to a theater near you. Guys, your body is exposed to stuff today. Monsters. I predicted years ago, that we were going to see antibiotic resistant infections. And I mentioned it even to you. Cellulitis. People get cellulitis. That can kill them. And they're so resistant. And it reoccurs. You better be taking a broad spectrum probiotic. I'm telling you. And I tell everyone. Mommy, you take probiotics when you're expecting. Absolutely essential for you and for baby in the placenta. Because one of the biggest reasons, by the way, I know I'm getting sidetracked, one of the biggest problems in our society today, you know where you, as a baby, pick up most of your bacteria? Is when you're sliding down the birth canal. When a baby slides down the birth canal. And they get full of mommy's mucus. They get mommy's mucus in their everything. From the nose to the mouth to the eyes to whatever. It's actually very good for them. That's where they pick up their microbiome. And when that is shortchanged, look, I get it. Please don't come after me. But when you come via C-section, which is so popular today, that child is much more susceptible to infection, to autism, to mental health issues. I'm telling you, because they're not picking up that broad spectrum probiotic from mommy's mucus. Yeah. It's part of our modern society. And look, guys, I didn't make this up. You know, they were told, and again, I did this, I don't know how many months ago, talking about gynecologists and obstetricians. Stop doing C-sections routinely. Now, I'm not saying, I know C-sections can save a mother's life or a baby's life. I understand that. Please. But they were doing far too many, and even the medical associations, the colleges of physicians and surgeons were telling them, we don't want that. You're doing too many. Okay. But did they get the memo? But if you don't understand, you see, the basics of bacteria, the invisible war, I call it, that goes on. If you don't understand the basics of that, you know, and a lot of people, and, you know, with autism, and they talked about, you know, vaccines and whatever. I was always a guy, always, and I've been consistent. I've always said I was more concerned about antibiotics, the overuse of them. Because I know they save your life. I never want to get rid of antibiotics. Never. But the two-edged sword that I've talked to you about many, 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 many times. Yep, it's a two-edged sword. Isn't it interesting? Mental health this morning. In your gut. GABA. In a bacteria. Isn't that crazy? Neurotransmitters. Unreal. And antibiotic resistant E. coli. Need to take probiotics, folks. You need to take probiotics. And I love fermented foods, so don't get me wrong. You want to eat pickles? I like pickles. I like fermented foods. Sauerkraut. But the broad spectrum probiotic, in my opinion, needs to be therapeutic. And you need all the different bacteria. It's one of the marvels of the nutraceutical industry. Okay. We're going to have fun this week, guys, I promise. Okay? So, Friday's question and answer, I'm preparing you, but here's the big thing, midweek, Wednesday. Okay? If you haven't seen our emails, sign up Wednesday night. We're going to have a little webinar. You get to see the brains of the operation. Tony Jr. on with his daddy. And we're going to be talking about blood work that we like and how to analyze it and what we're looking for. And I think you'll like that. I think it will be, you know, I talk about it a lot, but I think it's good to go over it in a webinar fashion. and, you know, slides and all this kind of thing that you folks like. Okay? That's Wednesday night, 7 p.m. Okay? What's the date Wednesday? I don't even have my calendar in front of me. Okay? So that's Wednesday night, 7 p.m. But you need to sign up so that we can send you a link to get on. Hopefully I get on. Okay, guys. We love you, and we'll talk to you soon.